By Caroline Wilson. Glasgow's Troubled Health Board has been placed at the second highest level of escalation following the death of 2 children linked to water contamination. The Scottish Government said the move was due to ongoing issues related to infection prevention, management and control at the Queen Elizabeth University Hospital. Stage 4 escalation is imposed when there is significant risks to delivery, quality, financial performance and support. The government said a dedicated Oversight Board will be put in place to oversee the hospital, headed up by Professor Fiona McQueen, Chief Nursing Officer, and there will be dedicated support for infection prevention and control. It comes after it emerged 2 children, a 10-year-old girl and a 3-year-old, had died after contracting infections, but their deaths were not made public. In a statement, Heath Secretary Jean Freeman said, "In light of the ongoing issues around the systems, processes and governance in relation to infection prevention, management and control at the COI and the RHC and the associated communication and public engagement issues, I have concluded that further action is necessary to support the board to ensure appropriate governance is in place to increase public confidence in these matters. The intention of the escalation would ensure appropriate governance is in place to increase public confidence and strengthen current approaches that are in place to mitigate avoidable harms." The mother of the 3-year-old boy who died said she is still seeking answers, claiming her son was extremely healthy when he was admitted. Victoria Freeman's son Mason Jmack died suddenly in August 2017 at the Royal Hospital for Children in Glasgow, weeks before 10-year-old Millie Mayne. The toddler, who suffered from a rare genetic condition, had been treated at one of the wards that were later closed following concerns over the water. Kimberly Darroch has already said she is 100% certain the death of her daughter Millie, who was being treated for cancer, was linked to contaminated water. Ms. Freeman said she is disappointed at the response from authorities, as she seeks answers over the death of the son she absolutely adored. She told BBC Scotland, "Mason was the love of my life. Unfortunately, I will never be able to replace him. Never. He was just really something. I absolutely adored him. There was no one listening to me. No one wanted to help. No one at all." Ms. Freeman said she first wrote to the Health Secretary last September and has been disappointed by the response. She said, "I don't think that Mason was acknowledged, particularly by her, and I feel that she did not take Mason's death seriously." She also said she got no response from the Health Board NHS Greater Glasgow and Clyde, NHSGGC, until she went to. For more on this story, visit the news article link.